Hello, I'm Dr. Bittiker. I'm back to do another presentation here. What prompted this one was that I saw an ad in the paper recently, and it was advertising a product called BioPQQ, and it was by Dr. Oz and Dr. Sears. These are good guys. I think they do excellent work. I've seen Dr. Oz's show, and I get Dr. Sears' newsletter, so these guys really know their stuff. So I'm glad. But they mentioned this thing about the BioPQQ. The chemical name for that is called, I'll try and get it right, pyrroloquinoline quinone. I know why we call it just PQQ or BioPQQ. Now, what does this stuff do? Well, if you want to find out more about this and get some good research on it, you can go to a website called Self-Hacked, SELFHACKED.com. It is by a guy named, where's his name here? Well, his last name is Cohen. And in there he goes over 11 things that PQQ does. And I'm not going to go over all the things. I can just suggest you go to the website, Self-Hacked. His name is Joseph Cohen, C-O-H-E-N. Self-Hacked is a website. Go there. You've got a lot of other information there too. But look on the one that he says here about the 11 things that PQQ does. And one of the main things that I focus on here about how I use it in my practice is that its effect on the brain and the heart and the pancreas in particular. Here's what it does. I use a product called SR coenzyme Q10 with PQQ. This is the coenzyme Q10, but it's a special form. It's the maltodextrin kind, very, very absorbable, highly active in the body. And what is it that these things all have in common? Well, I'll show you what it does. Inside of every one of your cells in your body is a thing called the mitochondria. And the mitochondria are called organelles. They're little teeny tiny things. And what they are is they're the little engines that create the energy that drives your cells and keeps you above room temperature. In fact, the organelles that do this, you take food into your body converts it into either glucose or ketones. It goes to the cells, it's absorbed across the cellular membrane, gets inside there, it gets eventually into the mitochondria, and there by an elaborate chemical process, it's converted into a thing called ATP, adenosine triphosphate, which then, through a series of chemical reactions, the body goes down to biphosphate and down to monophosphate, and then it's resumed back up, it's restored back up to ATP, and it just repeats. And each time it does that, it goes to the next level, it releases some energy, and that's what drives your cells. And like if anything that requires activity in your body, such as movement or cells regenerating, it requires ATP. The areas in your body that have the highest concentration of ATP and or mitochondria are your heart, because it's always got to be beating, and your brain, because it's always got to be thinking or doing something, and also the pancreas is a highly complex source there too. Now, why these 2 or 3 organs is it concentrated there? Well, you know, most of your oxygen in your body goes to 2 places. It goes to either your brain or to your heart because there's a lot of activity going on there. And so it actually takes quite a bit of oxygen to think with. Well, one of the problems with oxygen is it creates what are called free radicals. In other words, one of the theories of aging and death is that you die from the damage of free radicals accumulating in your body over the years. So the very thing that keeps you alive, keeps you above room temperature, and keeps you functioning is also the same thing that will eventually kill you. The trick is just to slow it down as much as you can. And that's what this stuff is all about here. Now, the main thing that this PQQ has been shown to do is to cause the biogenesis of the mitochondria. What does that mean? It causes the mitochondria to actually multiply. More of it. Up to 400% in some animal studies. Now, that's a big deal. Now, how does this play out? Well, we find out that in some people, for instance, the people that have problems with their brain, such as Alzheimer's, the buildup of amyloid beta, proteins in the brain, tau entanglements and all that. Also with the cardiomyopathy, people's heart becomes weak or congestive heart failure. What are we finding out there? Those are energy diseases. By that I mean the brain and the heart simply are not producing enough energy. The heart in particular is just simply not producing enough energy to rebuild its own muscle and to pump the blood throughout the body as it needs to be pumped. So you end up with congestive heart failure resulting from cardiomyopathy. That's why in studies have been shown that in some types of cardiomyopathy are completely reversed by coenzyme Q10. Not all of them, but some of them are, if it's that particular one. Same thing, we found out that PQQ can stop or reverse the formation of amyloid beta in the brain, which leads to Alzheimer's. It's also been found to reduce or slow down or even reverse cognitive decline. the slowness and thinking that occurs with people as they get older. Also, it's been found to dramatically improve the activity and function of the pancreas. And remember how sometimes Alzheimer's is now called, sometimes, not always, it's called the third form of diabetes. You got type 1, which used to be called juvenile diabetes, usually occurred in children. And then you have the adult onset diabetes, which is now called type 2. Now they got what they sometimes are referred to as type 3 diabetes, which is Alzheimer's. Because you see a very, very high correlation between Alzheimer's, dementia, and diminished cognitive capacity in people as they get older related to diabetes. And we find out that almost all adult onset diabetics have a chronic coenzyme Q10 deficiency and a quinolone deficiency too. So, what do we do with our patients, particularly patients that have fibromyalgia and or chronic fatigue? I've seen some dramatic turns around. I've also seen patients who were diagnosed with Alzheimer's, incorrectly I might add. You put them on a nutrition program and all of a sudden they're back. It was not that their brains really were deteriorated, it's just simply the energy levels were so low that they couldn't function like they should be. Particularly those people who've had a stroke and then may have some damage afterwards. Those people I recommend that they might want to take this, but they also might want to see a medical doctor who prescribes hyperbaric oxygen therapy. I've seen that do some remarkable things. I've had people that I referred to somebody for hyperbaric therapy because I don't do it in my clinic. They couldn't talk because that part of the brain for speech had been destroyed, so they thought. It wasn't destroyed, it was dormant. And now you can't always do this with all people, but this guy, put him in there and he immediately starts to talk when he's inside. Then when he came outside the hyperbaric chamber, he lost his power of speech again, but he had a little bit left. Each time he went in, it got better and better until finally he could talk permanently and he didn't have to stay in the hyperbaric chamber to talk. It came back because that brain part that had the speech pattern, sites in it, it wasn't dead, it was just weak. And when we got enough oxygen to it, it turned on again, so to speak. So that's something we recommend. Now let me give you some other things that I use. This particular product, this SR COQ10 with PQQ, it has 100 milligrams of the coenzyme Q10 and 20 milligrams of the PQQ in it. Let me show you what some of the things we use it for and how important it is. An example here is, this is some research on coenzyme Q10 with this to treat cardiac arrhythmias, atrial fibrillation. And also, this is post-surgery. In this particular study, we see that the coenzyme Q10 decreased the incidence of patients, this is a study done in Europe, of dying from a second heart attack after they had the first heart attack by about 45%, which is not bad when you consider it's only a supplement. Also, we found out that the use of the PQQ in reperfusion studies, in which, say you're doing heart surgery on somebody, you have to stop the heart, reshunt the blood through a heart lung machine while you're working on the heart, and then you got to restart the heart, hook it back up, and restart the heart. That's how it's done. I've never done surgery, but I've heard that's how it's done. But one of the problems is when they reperfuse, when the blood goes back into the heart, sometimes it shocks the heart, and one of the effects is a very severe cardiac arrhythmia, so they turn the heart back on, let it start beating again, and it goes into arrhythmia, and sometimes it can be life-threatening. Well, medical doctors commonly use metoprolol or another drug similar to that to stop the irregular heartbeat. Well, it's found out that the PQQ and coenzyme Q10 are better for that and have like 0 side effects. Not bad, huh? So that's another thing it's used for. Here's some other research on the coenzyme Q10. Atherosclerosis, heart of the arteries. There you go. Here's a study. This is from Clinical Investigations, 1993. Really good studies on that. I find this myself with combination of the SRQ10 with PQQ, the nitric oxide ultra, which is the vasodilator that I use on my patients, and also the vitamin C and lysine, all of the Linus Pauling therapy, type of therapy for reversing plaque in the arteries. We have a machine called arterial stiffness index machine, and we get rather dramatic decreases in heart of the arteries. It's not that difficult to do. In fact, we just had a patient come in today that was bragging about how their cholesterol dropped 100 points in just like a couple months. That's how this stuff works. On to some other research here on coenzyme Q10. And you want to make sure you get the right kind, because usually most people use the ubiquinone, which is the cheap stuff. It 1/4, 1/5 is absorbable as the ubiquinone and or the Amerivac like this, the really potent stuff. Here's some research on the treatment of cardiomyopathies with, this is a peer-reviewed study. It significantly reversed it in most cases there. Again, used to treat congestive heart failure. Here's another peer-reviewed study. This came from the Molecular Aspects of Medicine, 1994. This involves some 2,664 patients, and let me see, the 54% of patients had dramatic improvements, which for that type of condition, which usually doesn't improve at all, was rather dramatic. That's just a simple, that was just 100 milligrams a day, which I would have given more. I typically recommend 200. Oh, one more thing before we come to the end of the program here. Statin drugs, lower your cholesterol. You know why you get so many side effects, such as wasting of the muscles? Remember, your heart is a muscle, but people get rhabdomyolysis, where their leg muscles waste away. What they call the fog that goes along with it, the statin fog. The brain just doesn't work well, and also liver enzymes start to climb up and start to get into liver damage. What's going on there? Well, the statin drugs deactivate coenzyme Q10 through the destruction of an enzyme called reductase, and it damages it. So one of the ways to save yourself from the side effects of statins is to take coenzyme Q10, particularly SRQ10, because the statin drugs are toxic to your mitochondria. That's why people that take statin drugs, over half the people that take statin drugs have to stop taking because they feel so bad. Their energy goes down, erectile dysfunction, they get liver enzymes start to elevate, they get liver damage, they can get into congestive heart failure, all these things and tend to lower cholesterol, which, by the way, is not much of a risk factor. But you can protect yourself from it with SRQ10, with coenzyme Q10 in it. So there you go. So that's one of the reasons why we recommend this. You got any more questions about this, coenzyme Q10 or the PQQ, give us a call. And in fact, you can go to purecaps.com website, read their research. I'm going to have a printout right here that I have. You get the research on it.
It's now pureencapsulations.com.
Okay, pureencapsulations.com. If you got a question, call the 800-326-5838 number, and I'll cover the topic here in another presentation like I did with this one. I had a patient have a question about it. Also, you can go to our website, naturalhealthandyou.com, watch our videos on chronic fatigue, fibromyalgia, cold laser therapy, all that sort of thing. We have a catalog there, too, in case you're interested. Tell your friends about what we do here. If you like us, share us with your friends. Thanks for watching.